Osteoporosis is a condition which is caused by loss of bone and also disruption of bone structure. And the effect of that ultimately is to lead to more fragile bones and an increased risk of fracture. What happens during life is, as we grow during childhood and adolescence, our bones grow and get stronger, and then round about in your 20s you reach your peak bone mass, which is the most bone you'll ever have in your life. And then probably from about the age of 40, both in men and women, you start to lose bone, and that continues throughout life. The fractures due to osteoporosis have very severe consequences. Hip fractures, for example, are associated with death in 1/5 of patients 1 year after the hip fracture. And about 1/3 of those who suffer a hip fracture lose their former level of dependence, so that they become institutionalized and can no longer look after themselves. There are many causes of osteoporosis. The common causes are getting older and being female, because women have a higher risk of osteoporosis than men. And estrogen deficiency, which occurs during the menopause in women, is an important contributor to osteoporosis. And then there are a number of other risk factors or underlying causes which can increase your risk of osteoporosis. And these are things like having steroid therapy, which is given for a large number of medical conditions, having chronic diseases like Crohn's disease or rheumatoid arthritis, which are associated with an increased risk. A number of drugs other than steroids increase the risk of osteoporosis, particularly aromatase inhibitors, which are used for the treatment of breast cancer in women. And then there are some lifestyle things. So, for example, smoking is bad for your bones, like everything else. Alcoholic excess is bad for your bones, and that probably means over 3 units a day. Calcium is very important in keeping the bones strong, and alongside with calcium is vitamin D, because we need vitamin D to absorb calcium from the intestine. Usually osteoporosis is diagnosed with a bone density scan, which measures the bone density mainly in the hip and in the spine. And this gives us a measure of bone mass, which is inversely related to fracture risk. There are a number of approaches to preventing osteoporosis. One of these is through lifestyle modification, for example, avoiding risk factors like smoking and alcohol abuse, and by taking good levels of physical activity, having good intake of calcium in your diet. Something else that can be done at this time of year particularly is to get more exposure to sunlight. The clocks are changing at the end of March, and this will enable us to get easier exposure to sunlight. And vitamin D is actually made in the skin when we expose it to sunlight. So a rough guide in order to keep your bones healthy is to get exposure for between 5 and 30 minutes a day, between the hours of 10 in the morning and 3 in the afternoon. And this will provide enough vitamin D to keep the bones in good health. And then later in life, when the risk of fracture increases, there are a number of pharmacological interventions which have been shown to significantly to reduce fractures in women and men at high risk of osteoporosis.